Hi and welcome to Nursing School Explained and this video on cranial nerves. Now, the neurologic assessment in general can be a little bit anxiety inducing because there's a lot to memorize. So with this video, I'm hoping to give you little tidbits of information that'll help you, first of all, with an acronym on how to memorize these cranial nerves, and then second of all, how to make sense of them if they are sensory or motor control nerves. And then thirdly, also hopefully by dissecting the names of the cranial nerves to give you a little bit more of information on how you can memorize them easier. So to start with, here's an acronym that I learned in nursing school that I found very helpful over the years to remember the correct order of these cranial nerves. And that acronym is kind of silly, but it works. OOO, to touch and feel very green vegetables, aha. So the first letter of the sentence of each word represents the cranial nerves, all 12 of them. So if we look at that, OOO, olfactory, optic, oculomotor, to touch and feel, trochlear, trigeminal, abducens, facial. And then here, very green vegetables, aha, which is vestibulocochlear, or acoustic is also what it's called, but you really have to memorize the V here for the vegetables. And then glossopharyngeal, vagus, accessory, which is also called spinal accessory, as well as hypoglossal. Okay, and then over here I have made a little legend, S for sensory, M for motor control, and B for both. As you can see, we have 3 cranial nerves that control both. And all the other ones, just really logically think about it. When there is sensory involved, it's some sort of a sensation. So is it either the patient can feel something, smell something, see something, taste something. And then when it's motor, it always has to do with movement. So are they moving their tongue, their eyes, their cheeks, any part of their face, of their cranium that we can assess? So that would be the motor nerves. And then some nerves actually can do both, and those are the trigeminal, facial, and glossopharyngeal. So let's go over those here. So number 1, cranial nerve is olfactory, which assesses the patient's sense of smell. Many times in the clinical setting or in the acute care setting, it's not really done because there's just not time and it's not really that important. But it's important to know how to do it in case it is required of you in the clinical setting. So you can take anything that you find in the hospital to help assess the patient's sense of smell. I would not go with an alcohol wipe because that can be kind of very shocking to the patient's nostrils if you've ever smelled that closely. Toothpaste typically works well, mouthwash, or if you have anything else like from a food tray that would maybe be cinnamon or something like that, that'll work. And you would always ask the patient to close their eyes and then occlude one nostril, have them smell whatever it is that you're using, and then the same on the other one, and you're done with your olfactory assessment, the sense of smell. Number 2, optic nerve. This assesses the visual acuity as well as the visual fields. Visual acuity is usually something where you stand 20 feet away and you look at the Snellen chart and see whatever line the patient can read. There are certain Snellen charts that are to be used just in front of the patient, and you hold them 14 feet out. It has the same letters as the Snellen chart has and the same legend as to how to identify the patient's vision, because it might not be feasible for you to measure exactly 20 feet in the hospital setting if the patient is bed-bound. So the visual acuity as well as the visual fields, and that means the peripheral vision. And so if we look at our patient here, we want to assess the peripheral vision from different angles as we're coming towards their face. And so you're going to ask the patient to look directly at the tip of your nose. You're going to use some object, either a pen or maybe use your 2 moving fingers, and you're going to come from different angles and ask the patient while they look straight ahead when they can see this object to assess their peripheral vision. And it should really be a pretty broad sense of vision. You can try it on yourself, almost like a halo around the patient that is just a little bit in front of their face, which is where their normal visual acuity visual fields should be. So this was cranial nerve number 1 and 2, olfactory and optic, both sensory nerves only. Now, our oculomotor, cranial nerve number 3, motor, like the name suggests, is a motor nerve, so it has to do with movement. So we want to assess the patient's extraocular movement, EOM. And keep in mind, I have made asterisks here for cranial nerve 3, 4, and 6, oculomotor, trochlear, as well as abducens, because all 3 of them assess extraocular movement. Therefore, all 3 are motor nerves, but they just move the eyeball in different directions. So for oculomotor number 3, it's the eye movement up, and also perla, so pupillary response to light and accommodation. For trochlear number 4, it's the extraocular movement down in the visual field as well as towards the nose. And then abducens is the eye movement laterally out. Now, we're not going to ask the patient to move their eyeballs out towards their ears. It's going to be very hard to do. So what we're going to do to assess cranial nerves 3, 4, and 6 is to assess their extraocular movement by kind of making a star pattern in front of their face. So you can just hold a pen in front of their face, make sure it's not too close so they don't feel like threatened here. Maybe 1.5 feet or so in front of them, and ask them to focus on the pen and just with their eyes follow your pen that you're going to hold in front of them in the star-shaped pattern. And while they're doing that, you're going to observe their eyeballs to make sure that they're moving equally and that one is not delayed in movement or not moving at all, and assess their extraocular movement. So just with one test, we can knock out cranial nerves 3, 4, and 6. Now then, trigeminal nerve is the first one that has both sensory as well as motor control. And so the trigeminal nerve has 3 branches. Trigeminal, 3 branches. And if we look at the patient's face, the 3 branches on each side are on the forehead, the cheek, and the jaw. I like to show it in the clinical setting like this, where you have 3 branches, forehead, cheek, and jaw. And so we have to assess their sensation, their sensory response in these 3 locations. And so what you can do is take a cotton tipped applicator where the cotton is on one side and the wooden stick is on the other. So one of them would be dull, the cotton, and the other, the wood end, would be the sharp. You would have to tell the patient first what it feels like each side, and then touch them on each of those locations on both sides and see if they can correctly identify sharp and dull. And that is the sensory of the trigeminal nerve. Now for the motor response of the trigeminal nerve, you're going to ask them to open and close their mouth and then close their jaw and palpate the muscles, make sure there's no tremors or that there's no weakness there, as well as the corneal reflex. Now corneal reflex can kind of be scary for patients because it is the reflex that closes the eye when the eyeball feels like threatened, when there's something coming at it. Now we want to be very careful that we don't harm the patient's eye. So many times what you can do, you can take a syringe and just put a little bit of air in there and just blow the air into the patient's, from the side to the patient's eyeball, and they'll close their eye. The other thing you can do is gently grab a cotton ball and come at them, and they will close their eyeball in response of the eyelid trying to protect their eye. So that's the corneal reflex. It's pretty quick, but make sure that you're very careful, especially if you're suspecting that maybe that corneal reflex is not intact, because you don't want to, come at the patient with an object, even if it's just a cotton ball, and their reflex is not intact, and then you just poke them in the eye with hopefully just a cotton ball. But again, maybe the air option with the syringe is a little bit an easier one. So that was cranial nerve number 5. We've already talked about abducens, number 6 for extraocular movement. Number 7 is facial, and again here it has both sensory and motor innervation. So for sensory, for facial, it is our sense of taste, sweet and salty, so you could take sugar and salt and see if they can taste it. For motor response, we want to look at their facial symmetry. This is the one that we always think about when assessing a patient for a stroke. So we're going to ask them to smile, frown, puff their cheeks, And then at the same time, you can have them puff the cheeks and say, hold the air in your cheeks and don't let me press them in, making sure that the muscles there are intact. And then close their eyes real tight, and then you can try and open them. So those would be the motor response of the facial nerve, sensory as well as motor response here. And then for number 8, it's a mouthful, vestibulocochlear, and just think about it. Vestibular has to do with your balance, and cochlear is that little piece in your ear that helps you with your balance. The other word for it is acoustic, which acoustic you can think of has to do with hearing. So either way, you can remember the ear and the sense of hearing, but the V, vestibulocochlear, just works a little bit better with the acronym. So just keep that in mind. Otherwise, the A, you might get stumped up if you're looking for the A, but it's actually the V. That's our vegetables here. That's our very important green vegetables. So anyhow, by assessing the patient's hearing, usually if you're just talking to them, you can kind of know that they understand you. Maybe one ear is not as good as the other one in perception, so you could just go to the side of the patient, whisper something in the ear like 1, 2, 3, and then have them repeat what they hear back to you. And that's very easily done, one side and then the other, and you assess the patient's hearing. Then for cranial nerves, number 9 and 10 is glossopharyngeal and vagus. And glossopharyngeal, keep in mind that glosso has to do with the tongue, and pharyngeal has to do with the pharynx, and the vagus nerve is the one that is mostly in charge of the parasympathetic nervous system that slows everything down. So, but we assess these two together, and if you think about glossopharyngeal, so tongue and pharynx, it's gonna have to do with assessing the back of their mouth as well as their pharynx and their tongue. So what we're going to do here, this is the other side of the taste for sensory, sour and bitter in comparison to sweet and salty for the facial nerve. And then for motor, we're going to ask them, open your mouth, say ah. As they say ah, we observe with your pen light, you observe the rise of the uvula and the soft palate in the back of the throat, and then check their gag or swallow reflex. If the patient can swallow, if you've already seen them drink a sip of water, you've already assessed their swallow reflex. There's no need to stick a tongue blade back there and make them gag. Although it's sometimes important to do that, especially if you may be thinking that their swallow ability is not up to par, to do a evaluation of the gag reflex, which would require a tongue blade. So you would put the tongue blade in their mouth, move the tongue down, and then very gently touch the back of their throat next to the uvula, and then see if they have a gag reflex by, again, the soft palate and the uvula rising. So and that's both cranial nerves number 9 and 10, glossopharyngeal as well as vagus. And keep in mind here the glossopharyngeal, so we want to have the tongue and the pharynx move, so that's a sensory as well as motor, because the sensation is the taste, but the vagus is only a sensory nerve which has to do with the taste here. And then spinal nerve number 11 is the spinal or accessory. So I put the spinal in parentheses here, accessory. Think about it this week, the cranium, and then the accessory as the shoulders, because it's not really the cranium anymore for the cranial nerves. So it's the accessory muscle to the cranium, which assesses the shoulder shrug, as well as the patient's ability to turn their head left and right. So here we want to have them shrug their shoulders, but we want to place our hands on top of the patient's shoulders, and as they rise them, we want to assess to make sure that the strength is equal, as we always do, check for equality. And then turn head against resistance, so you can just gently place your hand on the patient's cheek and ask them to press to one side, and again you're going to feel for equality of that head movement. Last but not least, we have the hypoglossal, hypo, low or below, glossal, the tongue. So again, this has to do with the tongue movement here, and again this is a motor nerve, just like the spinal accessory with the movement. So for the hypoglossal, we're going to ask the patient to stick their tongue out and then move it left and right. And as they do that, we observe for tremors and to see if the tongue as it comes out is at the midline or if it deviates to one side or the other. So it looks like this. Stick out your tongue, move it left and right. Very simple movement. So if you think about it, first of all, in summary, I think this acronym here is very helpful. It's helped me over the years, and even if I don't think about cranial nerves for several months or years, I just think about the acronym and it'll all come back to me. And then if you just think about what this tells you, so trigeminal has 3 branches to know about the 3 sides of the face, or glossopharyngeal has to do with the tongue and the pharynx, so you kind of already know the general area that you need to assess, and then you're going to know what it is that you need to do. And then M for motor, anything that moves, and then sensory is where we assess a sense, whether that's vision, hearing, smell, taste, or a sensation. So all of those. So thanks for watching this video on the cranial nerves. Also check out my other video that I have where I demonstrate the cranial nerve assessment on an actual patient. And also check out the other videos in my physical assessment playlist. And I see you soon right here on Nursing School Explained. Thanks for watching.